So today I'm going to talk about physiological anemia in pregnancy and explain a little bit about the hows and whys this happen and when we should be concerned. So in the very beginning of pregnancy, your progesterone relaxes all your smooth muscle tissue, making room for the expansion of your blood volume. And we often know that our blood volume expands by 50% in pregnancy. And what we don't know is the ratio and how that happens. So our plasma expands first. It expands by 50%, and the red blood cells only expand by 30%. And the plasma is the more liquidy portion of your blood, which assists your red blood cells in moving freely around through your body and organs and making sure that the hemoglobin, which carries the oxygen, is being carried around effectively to your body. So, in the very beginning, your hemoglobin levels will drop, which is in response to the progesterone making more room for your blood to flow, which is a completely normal sign, is a good sign that the body is responding well to the pregnancy. And as your plasma increases by 50%, your hemoglobin levels will again appear to be dropping, which is actually a good sign that the pregnancy is moving along slowly and is a presentation of the physiological anemia of pregnancy, which is actually a healthy presentation because your blood is expanding accordingly. As your plasma of your blood expands, it appears that your hemoglobin levels are dropping, which is a good sign because the blood is essentially getting thinned out by the plasma as it's all expanding in volume. So the numbers that we are normally taught to be concerned about are often presenting a normal physiological presentation of anemia in pregnancy and are not always a cause for concern, as we generally become presenting anemia in pregnancy and are often prescribed treatment for anemia. And the only time that I think treatment would really be necessary is if a woman is physically presenting signs of anemia. If she's very tired or if she is very pale and lethargic, these are signs that anemia is actually taking place. But if your numbers of hemoglobin are dropping, then that can just be a good sign that your body is expanding its blood volume in the way that it naturally should be to support a healthy pregnancy. Studies have shown that a hemoglobin drop to 9.5 or 10.5 actually has the best results for a healthy pregnancy and healthy birth. So now that we understand how and why the blood expands, in what ratio, we have a better understanding to the presentation of anemia in pregnancy and why it's totally normal. And the only time that we should really be concerned is if the mom is having trouble in presenting negative ways of anemia. And we can help support that by nettles, red meat. There's tons of different food that provides your body the ability to grow a healthy blood supply in ways that are even better than a lot of supplements that exist. So if you're helping a mama or you are a mama who has some low hemoglobin levels in your blood when you're pregnant, then that can be okay. It's just really important to make sure that you're eating really nourishing food and you're supporting your blood supply in a good way. Thanks.